All right, what is a breast reduction and who needs a breast reduction and how do we do it? So a breast reduction is essentially for individuals who have either gigantomastia, which means very large breasts, that are hurting their back. Usually they're having complications from having such large breasts. Usually they have infections underneath the breast fold. They're having back pain. They're not able to work out or do their daily activities due to the size of their breast. In that case, breast reduction is the solution for you. It also helps essentially fix a lot of the aesthetic also issues of the breast. So if the breast is large, for the most part, it's usually droopy. The nipple is not in the right position. So having a breast reduction helps repositioning all of those. How do we do a breast reduction? So usually a breast reduction is similar in nature to a breast lift, but in a breast reduction, we take a lot of breast tissue out in order to reduce the size of the breast and kind of solve the issues that you were having before. So there are different incision types that we use for a breast reduction. For usually there's either what we call a vertical breast reduction, where the breast incision is around the nipple and straight down the breast, just a vertical incision, the lollipop incision. That incision is usually good for people with kind of moderate sized breasts. And we have to kind of examine you and discuss if you're a candidate for it. But usually if you have a lot of skin, super large breasts, then the best incision is doing what we call the anchor incision, which goes around your nipple, straight down your breast and at the breast fold. The other issue would be the blood supply to the nipple. How do we preserve it? There are different ways of doing it because we're taking a lot of the breast tissue. So the more breast tissue you take, the more you compromise the blood supply to the nipple. If you have really large breasts, then you might not be even a candidate for either of those two incisions. And we might have to do what we call essentially kind of a mastectomy. It's not a complete mastectomy like they do for other issues like breast cancer, but essentially we take a lot of the breast out and we take the nipple with it and remove it out as essentially a skin graft and replace it as a free nipple graft. That is very rare, but it usually happens for people or individuals with really large breasts where you need to move the nipple a whole lot and you can't preserve the blood supply that is already there because you're going to take a lot of the breast tissue. Other ways of preserving blood supply to the nipple for individuals who don't have super massive breasts or you don't have to move the nipple a whole lot. It includes what we call pedicles, where we preserve some breast tissue with the blood supply that is connected to the nipple. This can be placed in more than one location, so the blood supply can come from the top part of the breast, it can come from what we call the medial part of the breast, or it can come down from the bottom part of the breast, or even the lateral part of the breast. Each one has its benefits, each one has its potential complications. We usually will discuss those with you during your consultation. We opt usually for the inferior part of the breast pedicle for individuals who have to move a whole lot because it has a wider base and gives a more robust blood supply. It does tend to have a little more weight at the bottom part of the breast, so the breast might look a little on the boxy side or a little more droopy than the other pedicles, but it usually is a safer option for moving the nipple a long distance. The medial pedicle or the superior pedicle usually preserve more volume where you want it, which is in the superior part of your breast or the medial part of the breast where the cleavage is. But sometimes if you have to move the nipple a long way, those might not be sufficient. So we might not opt for those. The latter one has the least amount of blood supply, so it's not the best pedicle, but it preserves the most sensation to the nipple. So it's an option if that's the concern, but again, it's not usually the most robust blood supply and it's the least one I go for, but it is an option. In any case, whatever your questions are about the surgery, whatever issues you think you're going to have or you want to concerns you want to discuss, we're always happy to see you in consultation and come up with a more bespoke plan that is tailored to your needs.